helps prevent dental decay. It remineralizes the teeth, preventing the acids and sugars to penetrate the enamel, causing the cavity. We do try to keep our patients away from whitening toothpaste just because they're very abrasive. Usually you want to stick to a well-known brand like Colgate or Crest. Right now we're seeing a lot of popularity in the charcoal toothpaste, and so we try to keep our patients away from those kind of toothpaste because first of all, they do not have fluoride most of the time, and because they're very abrasive. You always just want to make sure that you're not doing a very abrasive toothpaste. So as soon as you start noticing some sensitivity, we usually recommend that you discontinue using any of these whitening toothpaste.
And if you do have sensitivity, we typically recommend Sensodyne. And if you come into the office, a lot of times our patients that are high risk for cavities or high risk for just having a lot of recession, they typically have a little bit more sensitivity because now their root surface is exposed. And in those cases, we do a prescription grade toothpaste, which we call Fluoridex.
I feel like there's two very popular electric toothbrushes. You'll have the Sonicare, and then you'll have the Oral-B Balm. And I feel like the bigger difference between those two is probably just the toothbrush style. So with the Oral-B, you have a lot of different size toothbrushes to choose from. You'll have your traditional long toothbrush, then you have the round toothbrush, and then they even have like something that works for interproximal spaces. Whereas the Sonicare usually only has the traditional toothbrush head, which is just the long toothbrush head. And so they also different in movement. So I think the Sonicare does more like a vibratory motion against the teeth, whereas the round toothbrush on the Oral-B Balm, it does an oscillating movement. So it doesn't do like a whole rotation. It just kind of hugs the tooth and it goes back and forth this way, cleaning that very important margin as well. I feel like when it comes down to choosing which one you'd prefer, you can try to see which one causes like less splatter, which is like one of the bigger complaints we get with the electric toothbrush is the splatter and the messiness. But usually feel like a patient should kind of, look at some videos, do their research before choosing that type of toothbrush, where in my opinion is like an electric toothbrush is just 100 times better than a manual toothbrush for sure.
And another thing is if you're not using an electric toothbrush and you're using a manual toothbrush, I would highly recommend an extra soft or a soft toothbrush. And that typically has an S at the very top left or the right of the toothbrush, and no medium or hard or anything like that. And with brushing, you should not apply too much pressure because your gums can wear away and it can cause recession and also increase your sensitivity. So it depends on which kind of toothpaste you're using as well as what kind of toothbrush you're using. All of those things are very important.